Hi, this is Dr. Kimberley Linert, author of Visualizing Happiness in Every Area of Your Life and host of this podcast, Incredible Life Creator. And today I have with me Dr. Weidong Yu. Hey, Weidong.
Hi, Dr. Kimberley.
It is lovely to see you again because it has been so many years since we met
Yeah, it's
each
more than
other.
10 years since the last time we met in the conference.
That's right, in a conference in Arizona about microcurrent,
Yeah.
which is another, healing modality. So I'm just so happy to have you here. And just so other people know who you are, I'm going to go ahead and read your bio. So Dr. Weidong Yu is a doctor of traditional Chinese medicine and the founder of Sightsage Foods and Nutrition. His medical training began at Shandong College, where he earned a Bachelor of Medicine degree with dual training in Western and Chinese medicine. Dr. Yu later completed a master's in public health at the Free University of Brussels, which expanded his perspective on integrative healthcare. Over the past 4 decades, Dr. Yu has specialized in treating complex retinal disorders, particularly retinitis pigmentosa, through his Wellspring Vision Improvement Protocol. To date, this protocol has been applied to over 800 RP cases with clinically validated outcomes, challenging conventional expectations for this genetic condition. So I just want to say to people, in case they don't know what it is we're talking about, I'm an eye doctor, I'm an optometrist, and there's something called retinitis pigmentosa that affects the back of the eye. And when I was in school, and even as long as I can remember, we were taught that if someone has this genetic disease in their eye, that eventually they're going to go blind. There's no treatment. There's nothing you can do. And then I met Dr. Yu, and he said he was treating people and they were getting better. And that is so exciting. That is so exciting. So I just want people to know this is like miraculous what you're doing for people, because not everyone is familiar with retinitis pigmentosa or RP. So, but I would like you to tell your story, because you went into a field that most people wouldn't even dare even try, tiptoeing into.
Yes, Dr. Kimberley. Thank you. In fact, I didn't start out to be an eye doctor or even to treat eye disease. When I went to the medical school, I studied Chinese medicine and Western medicine. So when I finished my university, get a bachelor degree, I worked in a Western medical hospital as an intern. And but at that time, my interest is all in history and philosophy. So I extensively study the history of Chinese medicine, history of Western medicine, the philosophy of West medicine and the philosophy of Chinese medicine, try to understand from a methodological point of view, what is Chinese medicine? What is West medicine? What's the future medicine for us, for the humanity? I try to study all those, unpractical theoretical issues on my own. When I went to Belgium in 1990 to study public health, so I have big plans in mind, what the public health care system should be in order to provide the best cares from both Chinese medicine and West medicine. And then I went to California. I practiced 3 years there. I came to Canada in 1997. By that time, I sat down, open my clinic. I say, what I'm going to do here, and what's my focus. I like to focus on something instead of be a generalist. So at that time, I select weight loss, insomnia, stress control as my clinical, focus or specialty. And I become an insomnia specialist, help people treat anxieties, sleeping problems, and help people lose weight. So, which means I never intend to be a specialist for retinitis pigmentosa or for even eye disease. One day there's a patient come here for weight loss. She has retinitis pigmentosa, the RP. So when I saw her, I said, wow, I said, your eyes, you're not going to see anymore. Why you worry about the weight? I said, let's start, maybe help your vision first. And she said, no, she said, Dr. Yu, I have tried to go to all universities, all the specialists, doctor told me there's no treatment for it. But I said, let's try for 3 months. If I can help you, yes. If I cannot help you in 3 months, I help you lose weight. Yeah, give me a chance for 3 months. Yeah, I'm not sure I can help or not. So I go back to check my books in my library, the Chinese medicine, the magazines, to see how other doctors in China has treated this condition. Chinese doctors has do a lot of research in this since 1960s. One of the very famous doctor, Tom, working in Beijing, he's have been treating this condition while I study and work in Beijing. So it's like between 1985, 1990, I worked with him. I know he's doing that. Although I was not interested in, but I know he's doing great result with it. So I said, we may have some chance. Give me 3 months. Let's try. After 1.5 months, she came back. She said, Dr. Yu, and I think it's working. I said, why? He said, last night I went to the baseball game. I went out downstairs, at night in the stadium by myself. Normally I didn't hold my husband's hand to go down at night. So my husband mentioned, look, you're walking by yourself. Then she realized she's getting better. Then she come back tell me, I still not sure. I said, go to the ophthalmologist, check your visual field. Then her visual field also expanded. I said, voila. So now you tell me you see better, the test shows better, it's working, let's continue. That's how we continued. And then next patient is her sister. And then for some reason, some patient find me and some way is ironic, and they start to treat more and more of these patients until one day one of my patients said, oh, you should put a website on it. So I put a website, then the patient from all the world start to learn what I'm doing as they come to Vancouver. So now I have treated, I think, more than 46 countries. The patient come to Vancouver. Yeah. And in the last 26 years. So I didn't choose to treat this condition. It's hard. And also it's a rare condition. In Vancouver, when started in 1999, so there are probably less than 200 patients in Vancouver. So you won't have any business if you try to specialize on RP. But patients are flying from all over the world. That's why we have been carried on for 26 years. And we made step by step great success for patients. Yeah.
Yeah, as you're speaking, it just gives me chills, just excitement thinking about that. The people who had no hope, they had no everyone, like you said, that first patient, and many of them, they go from doctor to specialist, hoping, praying that someone can help. And now you find this way to help, and people are coming from all over the world, and you're such a blessing to people, and it's because you mastered your craft. You you studied the history, you studied the medicines, you looked and you were curious, and you were willing to try to see if you could do it, and then you did, and then it just opened up this huge wonderful gift that you have, and I'm just so thankful and grateful for what you're doing.
Thank you. Thank you.
Yeah, so I encourage anyone at the end, towards the end, we'll talk about, how people can get in touch with you and everything. So, anyone that has RP or someone that has RP in their family, please reach out to Dr. Yu, because he's
It is
incredible
trauma
doctor.
for patients and their family when they first diagnosed as RP.
Mhm.
And the doctor normally tells the patient, you have RP, you will be blind, and we have no treatment. Wait for the scientific revolution,
Mhm.
discovery, as and so the patient, once they hear that, it's traumatized. And a lot of patients even go to extreme sports, try to kill themselves, by accident, or some patients, stop working, try to travel to see the world before they get blind, and they change their life. And for the family, for the husband or wife or the parents, it's heartbreaking. When we use traditional Chinese medicine treating the patients and they getting better, they email back to the family, and the whole family, their relatives are happy for them. And many patients continue to be a university students, finish their degree, and become a lawyer, become a teacher, and some patients even ski and driving, do normal life. And a lot of times patients come back to me to say, Dr. Yu, I have been thinking dozens of ways to suicide, but now I want to have a good life. Some patients even ask, where's the beauty salon here? They want to, the skincare, the hair, they start to love life again.
Mhm. Yeah, that is so beautiful. So
Yeah.
for the people who don't know what retinitis pigmentosa is, or RP, can you explain, exactly what it is, like how it starts? Because there's a progression to it.
RP is a genetically based progressive retinal degeneration, related to the blood supply reduced and less nutrient supply to the retina. So when the retina cells died, they start to losing the night vision, become narrow visual field, like tunnel vision, central vision also in time reduce to a degree they can get blind. People are afraid of light sensitivity, they see a lot of flashlights. And some patients, when they come to see me, they can't even see their fingers. I put the hand in there. I said, do you see the hand move? They say, yes. How many fingers? They cannot see. To that stage. And even to that stage, for some of the patients, we had a chance to bring them back, start to see the eye chart, line 1, line 2, line 3. It's amazing, how much potential our human body has
Mhm.
for self-healing. What we need to do is give the acupuncture, herbs, food, exercise to wake up this healing machine within our body. We
Mhm.
certainly ask patient and visualize happiness too. So you need to be happy into the positive mode. Yeah. So we are in the same path to
Mhm.
put our client into happiness.
That's exactly right. Exactly. So, when people come to you, like, they're coming from even around the world, what kind of protocol are they expecting? Maybe start out with telling people, some people know, but not everybody really knows what acupuncture is. Maybe
Oh, okay.
like, yeah.
So for traditional medicine, we believe, the RP is genetic related. We should, do the gene therapy to fix it. If you don't gene therapy, there's no cure, there's no treatment. But with Chinese medicine, we do a holistic approach. We don't really need the genetic test to divide our treatment protocols. And in fact, we ask people's symptom, their digestive function, their sleep pattern, their sweat, more or sweat less or night sweat. We ask all the general body functions, and we test the vision and the visual field. We measure how much uh, damage in the vision and the visual field, and then we give acupuncture treatment. We give herbal medicine, functional food, and we help them sleep. If they have insomnia, we give acupuncture to help them sleep. We make sure they have no constipations. They have a normal detox process. In fact, we really it clean up the body, empower the body, give them herbal medicine and the food to fortify the body function, makes them increase their vitality. Our focus is global. It's not on the genes, on the eyes, on the heart, on the liver, on anything. But amazingly, after 10 days treatment, most of the patients, like 85% of patients, will start to see the change. So our treatment program normally is 2 weeks, 10 days treatment with acupuncture, herbal medicine, functional food, and sleep, exercise, eye exercise, and all together. And also there's a component is a psychological consultation, because most patients comes with the fear, with the trauma. We need to help them relieve the trauma, relieve the fear, have a positive confidence, and we will conquer this RP. And that's the hard part. But normally the first session we need to deal with it. Yeah. So it's very holistic, and has not people ask, are you put needle in the eyes? No, we put people around eyes, we put people in the hand, in the feet, on the stomach. We don't put needle in the eyes. We don't think the problem of the eyes is the cause. That's the outcome. The cause is holistic. There's something wrong with the body. And how to assess something wrong in the body. That's where the traditional Chinese medicine, the ancient theories, the medical sense, they have created the ways of with the yin yang, 5 elements. We use that theoretical frame to assess. This patient has too much wood. This patient has too much water. This patient has too much fire. And then we use herbs, acupuncture to balance the 5 elements. And that's what the Asian tell us. But they don't know RPE, and they don't know genes. And we don't even examine genes and anything. Amazingly is when we use this methodology to make the global assessment, the treatment, and patients start to see better. The vision starts better, feel start better. The most quickest patient, one from India. She's a mathematics teacher and a yoga practitioner. She has less than 10 degrees of visual field. In 3 days, she opened 180 degrees.
That's amazing.
Yeah. So, and we did not, even investigate which gene is defect, and we did not put needles into the eyes. We did not put even eye drops into the eye. You know, we didn't even put herbs around the eye. We just treated the hand, feet, the global treatment. So in the last 26 years, I think I have explored a way, use global treatment, holistic treatment to improve a genetic related eye disease. If we can't put today's term, it looks like epigenetic treatment. Looks like what we did not change the gene part, we changed the expression of the patterns of the gene. That's how you can use those global treatment and from environmental change to influence a genetic expression and reverse the vision loss and improve people's life.
Yeah.
I'm
So,
happy. I'm amazed myself on a daily basis. I'm very happy to see the patient getting better.
yeah. And, often I'll say to my patients, I say, everything that in the body ends up in your eyes. I tell them the eyes are the end point for so many things. So if you want to have good eyes, you have to have healthy body.
Yeah, that's true. That's why we create the we use the plants, vegetables, and the fruits create cookies, gummies, and dry powders, for the tea, and give to the patients, and they need it, and they really feel better after they take those foods, because the body gets more healthy. And we didn't put any herbal anything in the eye. We just take the whole body getting better, including the eyes.
Mhm.
So that means it's it's true. It's something real.
Yeah. So I know you have created several products. Do you want to talk about some of those products and, what they are, why you created them and how they help people?
Yeah, I have a product Sightsage. Yeah, that's our best seller, Sightsage. Yeah, it's a Chinese herbal combination. What this do is, I can see this is the first product that can help and reverse presbyopia. When we reach to 50, we start to losing the sight and we need reading glasses. And according to Chinese medicine, is the kidney and the liver getting weak. It's an aging process. So this has a superfood goji berry as a chief ingredients, and plus all other like Chinese yam and dandelion. So we put a combination together to reverse the aging process. And the patient take this, and normally in 3 days, they start to see the difference. They can read the fine print better. In 3 months, they don't need reading glass. So this is our best seller. So now we're on our website, people take these products. And on the side is also very good for dry eyes. And people, I feel lubricated. When they take it, the tears produced from inside out instead of taking the eye drops from outside in. And this Sightsage help to improve the tear production for people.
Yeah, and that's really common. I know I see that every day in my clinic. People coming in with dry eyes and
Mhm.
also, allergies, sinus issues, because where I live, there's a lot of trees. So
Oh,
we have a lot of people with allergies, and then that's causing even more dry eyes.
mhm.
So, and people on computers have dry eyes, or as we get older, dry eyes. So, That's the solution for so many people.
Yeah, then the Sightsage is the solution from nature.
Mhm.
Yeah, today, we live in a screen intensive lifestyle, right? Nobody can live without watching cell phone or computer, including our meeting. You have to on a screen.
Mhm.
And so what's the second best solution is taking care of our eyes as we goes.
Mhm.
We cannot avoid the screen, then taking care of eyes when we're watching the screen, give the eye the support, nutritional support is needed to function properly.
Mhm.
So the goji berry is a superfood, and when we combine with the dandelion, turmeric, everything and the whole song together, and it makes synergistically powerful for the dry eye and presbyopia conditions. Yeah.
Yeah. And you have some other products too for dry eye. So, do you want to talk about those, or are they
Yeah, we
different
have
dry
another
eye?
product is for young people and kids is the blueberry gummy.
Ah.
So the Sightsage is made of goji berry, and this is made by blueberry. With blueberry, with one catch is combined with monk fruit.
Mhm.
Monk fruit is a Chinese herbs that nowadays people use as a sweetener, natural sweetener to replace canned sugar.
Mhm.
So it has no effect on our teeth, don't increase our weight, don't increase our blood sugar. That's why it's a candy without sugar, a sugar-free candy. And monk fruit also packed with trace minerals. And when they combine with blueberry together, it also has a synergistic effects better than just eat blueberry alone. So this blueberry gummy, take a gummy, also can help our eye feel comfortable, relieve the dryness from the eye. I tell our customers one gummy per hour. If you're watching the cell phone or computer work for 8 hours a day, take 8 gummies. Each hour, take a gummy as your snack. And then in the
Yeah.
afternoon, our customers do not feel eye fatigue and dry eyes. And amazing, some kids even see their myopia getting improved. If you do the test for them, you can see the prescription reduced. Yeah,
Yeah.
that's something we have reported from our customers. They said, "Oh, my myopia, I don't need my glasses."
Mhm.
Or go to my website, you check the reviews. It's a real patient's real review. And you will amazed by how powerful our food is.
Yeah, it is. And talking about food in general, is there some foods that we should not eat? Some foods we should always eat?
Oh, for the vision to
Mhm.
concern, and Chinese medicine believe the garlic and the chili peppers has negative effects on the eyes because garlic and chilies can have impact on the liver and compromise the liver function. And the liver is the organ that support the vision system. That's why in Chinese medicine, if patients has eye disease, we see no garlic and no chili peppers, lot of blueberries, raspberries, goji berries, carrot, eggs, especially eggs. The egg yolk has almost all the ingredients for vision. Everything our vision needs, like vitamin B2, like choline, like even we have the animal source of lutein. lutein are plant-based most products on the market, but egg yolk has the lutein, animal source of lutein. They have better assimilation. So when my patient come to Vancouver for treatment, I said, you need to eat 2 eggs a day, 1 egg for each eye, 2 eggs a day.
I was gonna say, when you cook the egg like that, it looks like an eye.
Yeah, they are, but they are great support for the vision.
Oh, that makes me feel good. That I've been eating 2 eggs for breakfast for at least 25, 30 years. That's what I eat every morning. 2 eggs.
Then your vision must be very good.
Actually, yeah, it actually is getting even better.
Yeah,
Lately, it's getting better. Yeah.
yeah, we are what we eat. If
Hmm.
we pay attention to the food we eat, certainly our body will respond to it. Yeah,
Hmm.
eat a clean food, functional food, the packed with the nutrients.
Yeah. Yes. So I was wondering, you said people come from all over the world, but maybe some people they can't come all the way there. Are you teaching other doctors what you're doing?
Yeah, I always go to different conferences and also had workshops to teach. Yeah, I just come back from San Diego. In fact, I went to a conference there. And also after COVID, I'm doing the conference online too. Sometimes I have online seminars to the colleagues all the world.
Mhm.
And May 10th, I will attend another conference in Vancouver talking about dry eye treatment with acupuncture, herbs, and also our functional food,
Mhm.
our Sightsage and blueberry gummy. For people with minor dry eyes and the Sightsage and the blueberry gummy, in fact, is sufficient to help them relieve. Yeah.
Mhm. Yeah. So I've been to your website and you have several different products there besides the Site C. So when people go there, how do they know which one they need?
Oh, yeah. So normally our customers will receive newsletters from us. On each email newsletter, we talk about a topic, for uh, vision, myopia, presbyopia, dry eyes, or fatigue, or weight loss, hair loss. In fact, we come to become functional food solutions for lifestyle problems
Mm.
in a digital age. Right now at digital age, we all live in a sedentary lifestyle, right? We don't go outdoors, we don't socializing. Some people tend to gain overweight. And then we create this wellness blend with 29 ingredients, freeze-dried ingredients packed together, provide full spec nutrition for our customers. So every day they take 2 spoons as a drink, as a like juice, fruit juice. They get sufficient supply from vegetables and fruits. Many people report this wellness blend has effect. Number one, on weight loss. Their pants, their clothes become bigger. They lost weight. Number two, if it take like 2 or 3 months, their skin start glowing. Yeah, one of customer said, her dermatologist say, you looks 15 years younger because they are nourished. After
Mhm.
2 or 3 months, they come back. I even cannot recognize them. I said, wow, you changed so much. Where you do your beauty? We thought it looks like they did the beauty surgery. It's so the complexion, even the shape of the skin has changed.
Mhm.
And that's is very popular in our clients. And also, like we all live in a stressful life. fast-paced, stressful life in the digital age, and you watch computer all day long, and if you stay away from computer, no, your boss will think you're not working. So you have, so it's very stressful. We create a product called the herbal adaptogen. Herbal adaptogen help customers to adapt mental and physical stress. So when they take that, they are in peace. Yeah, even the stressful stuff come to the work, anything, they are not annoyed like this one, this yellow label. They feel very good. And also when they are on the stress products, the sleep get better. One of the amazing also accidental discovery, we never intend to, is the young people. Among the young people, they have so many hair loss problem because of stress. And when they take the adaptogen X, they call it adaptogen X, and they stop losing hair, and then they start regrowing hair. Then our customers start to take this product as hair loss remedy. So you see, the nature has all the power, and we still haven't discovered them all, and we just believe and mix them, give to our customer. We have many unexpected effects. So weight loss and hair loss is part of digital lifestyle, and stress, insomnia, and allergy. So we haven't create a product for allergy yet, but in the future we will, because our company Sightsage is intent to be the lifestyle company. Anything related to the digital lifestyle, the challenge, we will use Chinese medicine, natural medicine to provide alternative to resolve, to face that challenge.
That is beautiful. Yes, as I'm looking, anyone who's watching on the video, because this is also audio, but behind Dr. Yu, he has all these containers of all the herbs. And I know for years when I went to my Chinese medicine doctor, she always has these herbs and she's taking them and she's put them in a bottle and counting out and writing the directions on there. Like the medicine was very custom because she went to her room and she would pick up the herbs and just give it to me. But now you have the Sightsage, products. You have it an easy a bottle. You could just take it easy. Gummies, you could take it easy. You're not, I remember drinking some not very good herbs. They taste very bitter and really difficult to drink it. And you have made it so easy to get high quality, effective, Chinese medicine.
Yeah, that's the key word, is that we make it easy and simple and taste good. You see, the gummies, we make it taste like a gummies. And even the wellness blend is drink like tea, like juice. So in the comfort of a good tasting product, safe as a food, so we help our customer to meet the challenge of everyday life, which we in the long term will hurt our health. So preventively, if you take those functional food, we can avoid to have serious eye problems. According to WHO, we have like 2 billion eye patients in the world. Only half of the patient can find an eye doctor. Half, they do not even find an eye doctor. We can't produce enough eye doctors to meet the growing population and the aging population. So one alternative or solution is put prevention first. Instead of wait until the patient gets, macular degeneration, glaucoma, then you deal with it with the surgery, with the things, and it's hard to cure them. It's better when people just have blurry vision and dry eyes. We provide functional food, eye exercise to help them in the long run avoid to become macrodegeneration or glaucoma. That's our logic behind all those products. We want to put prevention first, help people on daily basis before they have serious eye problems. Otherwise,
Exactly.
the doctors, the office is like in Vancouver, they wait 60 people waiting outside the door, the specialist, and each patient has a 2-3 minutes consultation, and still half of the patient do not find them where the eye doctor is. So
Mhm.
it's a big challenge. And with AI, with the based information, business and technology, I think this problem is getting worse over the next 2 or 3 decades.
Yeah. So, I know you're still doing more research and you even said in the what you sent me, you're going to be using the AI to expand. So tell me about what you're doing now, what you're working on now.
Yeah, with the AI, I think is a great gift for medicine. I would like to create a AI-based system to put my knowledge and my logic into the AI. And when a patient come to see a doctor, the doctor can just put patient information in, and this AI-based system will tell them what to do, a protocol according to Dr. Yu, what you need to do for acupuncture, for herbal medicine, for functional food, for exercise. And when the doctor apply it, they will see result. So that's how, in my vision, to leverage my knowledge for the, for the world. And let's say a doctor who never treated RP before, he intake the patient information, put in the AI. The AI will create a protocol for him to follow based on my experience. My job is sit in the back end to change all the logics, all the parameters to make it more and more effective. And also in the system, if we see one patient taken care by a doctor in Arizona 10 times did not get a good result, then we can take the case, look into it, and then connect with the doctor, say, hey, I think you can do this. We can hand on make recommendations to the doctor. Then I don't have to go over the world. I can just sit in Vancouver. I can help the doctors in the real world to help their patients. That's my vision for the future is create a smart Chinese medicine system for the eye conditions.
Yeah. Well, that's so exciting. And because, like I said, not everybody can travel to see a doctor. So if they can see their local doctor and that local doctor can help them using your protocols, that's just amazing.
Yeah, I think with today, like ChatGPT, all the technologies available, it become very real now.
Yeah, yes, for sure. So if people wanted to connect with you, come see you, um, know your website to get products, this is where you tell us about your services, what you have now. Where do they find you?
Or they can go to our website. My clinic website is tcmrp.com. So the TCM is traditional Chinese medicine. RP is retinitis pigmentosa. So the name of the website is tcmrp.com. So that's where you can email us, inquiry us for the further informations or making appointment. And for our product, you can go to Sightsage, sightsage.com, sightsage.com. It's the wisdom of vision. And our functional food are listed in this website. We ship all over the world. There are more than 20 countries in the world. The customer buy the products from us right now.
Wonderful. So they can buy it from anywhere then for a lot of countries. So
Yeah,
that
we
is,
use UPS to ship to the United States.
mhm, that is awesome. Well, now I have a question, a personal question that I ask everybody on the show.
Mhm.
What gives you the most happiness and fulfillment in your life at this point?
So I always say, I'd rather work in my clinic instead of stay on the beach, you know. So because that's give me the most fulfillment to see our patient getting better after the acupuncture treatment or herbal medicine treatment. Amazingly, people won't believe if you don't personally see and watch. Uh, let's say a patient with retinitis pigmentosa, they come in first time in their life, come to see me. I can give them a one acupuncture. After 1 hour session, we take off the needles, patient come out, and we check the vision, the field. For some of the patients, already starting response. But each program, when people come to us, is 10 days. And within these 10 days, most patients will improve. Like we just have a patient from Seattle. She had about 50 degrees of visual field, like 50 degrees. And now today is a fourth day. Today she has 180 degrees of visual field already.
That is just for people who are listening, this is like unheard of in the medical field. It's unheard of that people don't go to their
Unbelievable.
doctor after a few visits and get these results. So,
Unbelievable. I
yes.
know. That's patient feel happy, her mother feel happy, her husband feel happy. I also feel ecstatic, like you win a lottery.
Yeah.
If you win lottery every day, don't you happy? So
Oh,
that's
yeah.
me.
That
That's me.
that does. Yeah. Yeah,
Yeah.
that does
Because
make
they're not supposed to getting better,
Mhm,
Dr. Kimberley, is they're not supposed to getting better. But
mhm,
they indeed are improving in
mhm,
front of my eyes. And
mhm,
for 26 years. At the beginning, the doctors around us, they don't believe what I'm doing. But now, after 26 years, the ophthalmologists in Vancouver, they know, and they
mhm,
are interested, and they feel comfortable to have a coffee with me now.
mhm.
But
That's good.
you and Sarah is always the supporter of me. I'm really thankful because you believe that. You
Mhm,
see that, you think it's possible. That's not normal. For a lot of doctors, they don't believe it, you know.
mhm,
But now I sometimes go back to China to see the patients there. And even in China, the RP patients do not get the same results like in my clinic. So I regularly go back to China to see some patients, difficult cases, and improve them. And some of the patients almost blind.
mhm,
They don't even count fingers anymore. And I don't really know if I can help them or not. So in the first visit, I tell them, okay, it's end of the stage. You're almost blind. In fact, you are legally blind, and I'm not confident if I can help you or not. But if you don't want to give up, I want to do my best to help you. What I said to the patient literally is, let's just pretend after 10 days treatment, nothing will happen. Okay,
mhm,
let's start. Let's do it. Then you know what happens? After 5 or 7 days, patients start to see.
mhm,
Yeah, I didn't give them any expectation because too far gone. But even in those cases, at least I help like more than 10 patients from hand movement to see 2, 3, some 5, 6 lines on the eye chart. So that is making me feel job satisfaction and fulfillment, to answer your question.
Yeah, thank you. And thank you so much for coming on the podcast. I've been wanting you on here for a while and you're hard to catch. You're so busy. So thank you so much for coming on and sharing what your work with us.
Thank you, Kimberly. And we have tried to connect for a while, and finally we have time. It's time. And thank you for all your support and over the years. And I hope more and more ophthalmologists will, like you and Sarah, and let's celebrate the success of our patients, the healing power of nature.
Exactly. So I have one last question before we finish. What is your best advice on living an incredible, amazing life?
Oh, so from my experience, I think you must like what you're doing, follow your passion, then the work is not work. Work become a joy. So passion is the number one. Number two, you have to constantly improve yourself. You need curious enough to keep learning. You know, what I have learned in the university is too far gone. Now, what I learned today, you know, I'm learning AI, I'm learning social media, I'm learning, you know, the genetic, epigenetic. So you need keep learning and be curious. And the third is you need courage. You need to dare to be alone, a different, because just like this RP, when we first started, every people around me, especially our medical professionals, do not believe it. They have a lot of labels on me. So, but I face to the truth, to the facts. If the patient in front of me, they're getting better, I'm not going to give up. So a lot of times we dare not to be alone. We won't follow the crowd. When every people think RP is not treatable, then RP is not treatable. You don't even have that initiative. So that kill a lot of creative ideas. So we have to be courageous, to be alone, to be different, and as long as it's true, you know, just like our stories is unbelievable. It's unbelievable, incredible, but it's true. Yeah. And at the end, people will believe it. And our patients, normally the first time they come here, they half believe, half not believe. There's one professor from University of Pennsylvania. He waited 14 years to come to see me. 14 years ago, he was a PhD student. He saw my YouTube. He don't believe it. 14 years later, he finally believed it. He come to see me in Vancouver. That's how difficult it is to be the first one, to be the pioneer, because people don't believe you. But if you are faithful to the truth, after 14 years, they will come to see you. Yeah.
I love that. Thank you so much, Dr. Yu.
Thank you, Dr. Kimberly. Have a nice weekend.
Thanks. We'll talk to you again soon.
Sure. Let's connect next time. Yeah.